Hi, everyone. Lisa White with IVF Manifesting a Miracle, here for another clinical conversation with our fertility doctor friend, Dr. Greene. How you doing, Dr. Greene?
I'm doing great. How are you?
Wonderful. Happy early Father's Day.
Yeah, or what we like to call it, Future Father's Day for the people that we're trying to reach today.
Yes, that's the theme for today, this coming weekend, and I'll be sharing this in a timely fashion this week, hopefully. We have Father's Day approaching, and we want to do a talk for all of the future dads out there. So thank you.
And, you know, one of the things that I think doesn't get talked about often enough are really diet and lifestyle things that men should be thinking about so that they could be doing their part to optimize success rates, which means not only optimizing pregnancy rates for their partner, but lowering miscarriage rates. And these are important things to be thinking about, whether someone is trying to conceive naturally or whether they're actually going through fertility treatment or even IVF.
Yeah, there's a lot of things to consider, and I'm grateful for you and having this discussion, sharing your knowledge with us. You're the science data guy. You can guide us into knowing, what should guys be aware of? What can we advise them, to be doing to enhance their fertility?
Yeah, and I think, it always starts with trying to keep things as easy and honest and reasonable as possible, like just as one point of comparison, just to put things in perspective, when people are having difficulty conceiving, as men, we're contributing to the problem at least 30 to 40% of the time, okay? Now, ironically, as men, the vast majority of people have absolutely no symptoms whatsoever. And so, with women, we spend so much time asking them questions about their menstrual cycle, about pain, about all these different things. As men, you can't ask any questions because a guy that has a reduced, fertility doesn't have any change in his libido. He doesn't have any problems with his erections. He doesn't have any pelvic pain. So the reality is, guys can't assume they're fertile just because they've got strong desires or are able to do things when they want to. And so I think it's important that we have to start with the realization that as men, we're contributing to the problem, and therefore we have to participate in the solution.
The problem, if there are challenges getting pregnant.
Well, exactly. And or even staying pregnant. Like, I'll give you one example. For instance, there was a study that showed that men that were tobacco users, okay, even if they never smoked around their female partner, the woman was, would statistically have a very significant increase in the risk of miscarriage. So in other words, if a guy is exposed to tobacco and it's damaging his sperm, even though his partner might be able to get pregnant, that miscarriage, he may have contributed to that. And so doing things to not just avoid smoking around your partner, but avoid smoking altogether, and these are tips that I think don't get pointed out often enough, and guys need to be aware of it.
What's the cycle again of sperm genesis? What was it, the cycle?
Well, I mean, put it this way, it takes about 90 days on average for a sperm to go from being completely, a primordial cell to a mature, healthy sperm.
Okay.
Now, that doesn't mean that things suddenly happen 90 days later, but it means that, whenever you make a change, you can't see the full benefit of that change until at least 90 days later. But the point is, sometimes doing the wrong things, even on the last few days, can make a difference. Like studies show, for instance, people that are using pesticides and herbicides and not being careful of the way they're handling those products, that could have a very significant and very immediate effect on sperm quality. It could take several months to wear off. So when you think about the fact that women are fertile technically for less than a day, about 16 to 20 hours a month, that if a guy does something the day before their partner is releasing an egg, that could really have a negative impact. So one way to think about these things, and I try to keep all my advice practical. So I tell guys, think about things you would not do if you were holding a baby. And I think that puts it in perspective. You know, there aren't many people that would walk through a smoke-filled room where guys are smoking cigarettes carrying a baby if they could
Right.
avoid it.
Right.
Or you wouldn't spray Roundup on your lawn while you're holding your baby. Or you wouldn't be working on your car while all the diesel fumes are blowing in your face if you were holding a baby. And the point is, we're naturally very protective of babies because we know they're very sensitive to chemicals. Ironically, what I try to point out to men is sperm is even more sensitive. And so you got to read the small print. You got to take the steps. You got to do the due diligence. You can't completely avoid everything that's toxic, but you could sometimes take some very easy precautions to minimize the risk.
Wonderful. And starting as early as possible to avoid some of these chemicals. And I mean, it's never too, like 3 months with eating the right food. And we did this talk actually 2 years ago, a male factor fertility talk. So if anyone's interested in that, it's on my YouTube page. But June of 2020 is when we did this talk. So there's so many things you've covered and, you know, with that talk. And what else would you suggest for guys to be aware of?
Well, like one of the easiest pieces of advice, okay? And I tell guys, you know, sometimes you got to give people a soundbite. I tell guys, go nuts, okay? And what I mean by that is that in healthcare, we seem to have romanticized the impact of things that come in pill form, you know? And guys always ask, what supplements should I take, you know? Now, keep in mind, I remind people all the time, the word supplement is intended to fill in the gaps of an unhealthy diet. So number one, clean up your diet and try to eat a healthy diet to begin with. But most supplements are based on research that eating certain foods can actually be associated with higher fertility rates, okay? And one of the things that's most consistently been demonstrated is that nuts have all the right ingredients in the right proportions to give guys the same things that are recommended by the top supplements, okay? And they tend to be much cheaper and more convenient, you know, and there have been a variety of studies that have looked at specific nuts. Typically, these are tree nuts, so they're things like walnuts or almonds or pistachios or hazelnuts. But, you know, studies show that you know, increasing your consumption of nuts can actually very substantially boost the parameters associated with certain fertility outcomes. But more recently, some of the, and it kind of makes sense when you think about the fact that nuts are basically, you know, gametes or seeds to make trees, and sperm are gametes or seeds to make humans. It makes sense there'd be a common need, you know? But lately, there have been some even exceptionally well-designed studies. Like, for instance, one of the tests that's sometimes used to look for male infertility is something called a sperm DNA fragmentation test, okay? So basically, that's where, you know, you do a very detailed analysis or a sub-analysis of a man's sperm to see how much of the DNA is fragmented or damaged. Now, there have been studies that show that guys that increase their consumption of nuts by as little as 60 grams a day, which is like a handful of mixed nuts, okay, can see measurable improvements in sperm DNA fragmentation in as little as 3 to 4 months.
Wow. And unsalted?
Well, salt is a separate issue. That's really something that has a greater impact on blood pressure. That's never really been looked at in terms of its impact on sperm quality. So obviously it's good to be aware of salt consumption for blood pressure and vascular reasons, but we don't have any reason to believe that salt has any direct effect on sperm quality. But I'll tell you something that's particularly interesting. Some of these same studies on nuts have also been shown that you can get measurable improvements in erectile dysfunction. So guys that are having problems with sexual dysfunction often can get a lot of the benefits from improving their diet by increasing their consumption of nuts. And we understand the mechanisms and the science behind why these things would work. So it's not just random that these things would be found, but sometimes instead of taking a pill or a supplement, you could just go to the actual food source and try to get some of the same health benefits.
Okay, well, these are great. So too many nuts is not a bad thing. Like the nuts are good.
No, and one of the beautiful things about these studies is that they've been designed and followed by nutritionists. So several of these studies have been completed, and in these study designs, they're particularly not telling the men to reduce their calorie consumption. They're not telling them to increase their exercise or anything, but they have been monitoring for weight changes. And the vast majority of these studies either show that this sort of intervention is either weight neutral, meaning no weight gain, or occasionally can help support a modest amount of weight loss.
Okay.
And again, the point is when you add some healthy whole food to the diet, like nuts, you tend to feel less healthy, so you tend to consume other calories from other sources. So we used to worry about, the calories and nuts being a high-fat food. It really does not have any negative effect on weight or overall health.
Okay. You have to start serving those in your clinic, right? Little bags of nuts instead of the popcorn.
Well, that's not a decision I'm ever a part of. But the reality is, sometimes a small handful of nuts is one of the healthiest things you could recommend to guys that are trying to help boost their partner's
That's a
fertility.
really good tip. What about drinking? Like drinking too much, a lot of beer drinkers, things like that. Does that affect?
Again, this is, I think, another area where you could go to that reference I said and think about the type of things that you need to be cautious about when you're handling a baby. And I use that analogy because there's absolutely no evidence that mild consumption of beer, wine, or alcohol has any negative effect on sperm quality. Okay. And in fact, some things like red wine may even have some health benefits, including some potential ways by increasing antioxidants. But I can't think of anyone that would ever think it would be appropriate to be sloppy drunk while you're holding a baby. So again, using that same image, for guys that want to be celebrating future Father's Days, think about the way you would celebrate that future Father's Day. And most people would feel comfortable with a drink or maybe two. But if you're going beyond that, that's when you start to go into the range of unhealthy outcomes.
Let me ask you about staying cool down there.
Yeah. And again, this is another popular myth. And I actually did a blog post about this a couple of years ago. There was a very well-designed study because, again, the whole idea about heat having a negative effect on sperm was based on the theory. And we know the theory is that when men have prolonged high fevers, it has a negative effect on fertility. And we also have always believed that the testicles are located outside the body to lower the temperature, at which sperm are produced. And so people have put together these biological beliefs with the combination that the type of underwear a guy wears would impact sperm quality.
Boxes are briefs.
Well, and this was something that was pushed for many, many years, without ever having any data. Finally, there was a very well-designed study that took two groups of men, a group of men living in Texas and a group of men living in Wisconsin.
Okay.
And some of them were wearing boxers in both locations and some were wearing briefs. And they studied the men both in summer and in winter. Because you're dealing with two different climates that are kind of extreme differences. And again, it was a self-selected study, but they were actually monitoring the average temperatures based on, instrumentation that I can't go into, but also looking at sperm parameters, and they found no change. There was no difference between boxers and briefs. There was no differences between summer and winter. There was no differences between Texas and Wisconsin. And
Okay.
so again, it's not perfect data, but this was the best designed study that I've ever seen to try to answer this question.
Okay.
And, but then people ask me the same question. They say, what about hot tubs? And my answer to them, Lisa, I'm more concerned about the smell of all the chemicals that you have to use to keep the water in a hot tub clean than I am the temperature.
Oh,
And so I always say, if you're going to be in a hot tub for a short period of time, no big deal. But if you're in there for a long period of time, probably not a good idea. Just like you wouldn't go in for a long period of time holding a baby. But I'm actually more concerned about the chemicals. We have to use really harsh chemicals in order to keep hot tubs safe.
Any ideas on a pool? What about a pool? Because those chemicals.
And again, I think it's why you got to be careful.
Okay.
Think about it. I worked for many years as a lifeguard. And when I was doing things with pool chemicals, I would never want to do those things while I was holding a baby.
Yeah.
We used to wear special gloves and try to make sure that we were upwind of things and stuff. So again, paying attention to things and thinking about how you would modify your activity is an easy and simple guideline to try to help direct you when we don't have perfect research.
This is so good. So helpful. Oh my God.
And one last thing I think we should maybe talk about that doesn't get enough attention is sleep. So a lot of guys don't sleep well. And one of the things we're starting to learn about, and you and I have talked previously about the benefits that melatonin, a hormone that we only produce during healthy sleep, how melatonin correlates with healthier egg quality, and research studies that show that. More recently, studies show the similar findings in men. And so, for guys that either don't sleep well or they're not sure how well they're sleeping, taking a melatonin supplement at bedtime may actually be another way to try to optimize their fertility potential. And not surprisingly, this is also something we learned during the COVID epidemic. It also improves our immune status. So there's other health benefits to things like healthy sleep than just, feeling energy the next day. And so another thing that is simple, we can't really measure a guy's melatonin level unless we show up at his house and wake him up at about 2 o'clock in the morning and draw his blood. So this might be a situation where taking an inexpensive melatonin supplement, 3 to 5 milligrams around bedtime.
Okay.
Even if you think you're sleeping well, this might actually provide additional fertility benefits, particularly for guys that don't think they're sleeping well or are frequently traveling back and forth across time zones or doing shift work or things like that.
Wonderful tips. So 3 to 5 milligrams. Okay.
3 to 5 milligrams a day.
So good.
At bedtime.
At bedtime. You don't want to take it during the daytime.
No. And honestly, a lot of people worry that melatonin is going to make them feel sleepy, or they feel disappointed that it doesn't. That's not really how melatonin works. The natural hormone melatonin is not something our brain typically starts releasing until about midnight, which is usually several hours after most people have fallen asleep. So melatonin is not something that our body normally releases to induce sleep. It's something that our body uses to help maintain sleep. And again, one of the things that a lot of men will notice is they have no difficulty falling asleep, but they're waking up in the middle of the night. That's often a sign of melatonin deficiency.
Very good advice. I hope people take all these tips, and you got to eat your nuts. You got to get that melatonin.
Yeah, and pay attention to your activities, because if it's something that you don't envision yourself doing when you do have a baby, you should at least take some extra precautions to try to minimize the same impact that activity or those chemicals would have on you as they would have on your child.
Wonderful. Thank you so much. And how are you going to celebrate this weekend? Any big plans for Father's Day?
Yeah, I'm going to celebrate it with my embryo. My embryo is a teenager now, so.
I love it. You're one and we have our one. So it's pretty special for sure.
Absolutely.
Oh my gosh. Well, thank you. You're at enhancingfertility.com. I'll link it. And I'm at ivfmanifestingamiracle.com, and stay tuned for another clinical conversation. Thank you, Dr.
Stay
Greene.
happy, Lisa.
You too. Bye, everybody.